Okay.
All right, so I know I've been chatting with a lot of you. For those of you who don't know me, my name is Kevin Johnston. This is my 15th season here at the Renaissance Festival. These past 5, I've been Count Victor, the evil villain, so I walk around and recruit minions all day and play with the patrons. Prior to that, I did 6 years as the prince, so everyone I met was either a prince, well, every girl I met was a princess. Sometimes it got a little interesting. Watched a lot of jousts, and my reason for telling you that is whenever you're digesting information, obviously consider the source. And not only, what makes me qualified to tell you about any of that, I am licensed for life and health insurance. In my day job, I work as the director of employee benefits for a company that does HR and benefits administration. I also did the 4.5-hour-long certification course through the Center for Medicare and Medicaid that you have to do as a broker in order to also be able to connect people through the Affordable Care Act Exchange, ACA Marketplace. Originally called Exchange, rebranded as Marketplace. That's just marketing. So what's in it for me? Probably nothing. Most of you probably live in a state that is not Arizona, where I couldn't even help you land on a health insurance plan if I wanted to, and frankly I don't do that a whole lot anyway. Somehow there may be a way that if you are an Arizona resident I could even get credit for signing you up, but frankly most of the commissions on individual health insurance are scaled back. The most competitive provider carrier in the state of Arizona lately has been HealthNet of Arizona, and I understand they pay like 2% is their commission. So if someone's paying, let's say, $200 per month for their health insurance, that would be a $4 per month commission. I'm not real worried about it. At the end of the day, the community here is important to me. That's why I made the trip and put all this together. So it's important timing right now. Here we are on March the 19th. We've got not quite 2 weeks left until a very important day, which is the last day of March, which is your last day to register for an individual policy through the healthcare marketplace during what's called their open enrollment window. It started back in October of last year and is running through now as an extended open enrollment window. In the future, moving forward, it will be a much shorter time frame, and I believe it's going to be November through like the middle of January. And that is your once-a-year chance to start a plan, change your plan. That's your chance to make any changes. Otherwise, pretty much set it and forget it. Unless you have what's called a qualifying event, which means something happened in your life and now you get a new window to make a change. Usually that window is 30 days. So it could be marriage, divorce, birth of a child, a death. Often it could be loss of other coverage for you or for your spouse. They worked at a job, they lost their coverage. You have a 30-day window. That's your new, just for you, open enrollment window to sign up. The only one that's different that I've seen is if you had Medicaid coverage. Here in Arizona it's called Access. If you had that coverage and you lost it, you get a 60-day window, a little longer. So it's important to sign up now, because now is the first year in 2014 where if you don't have coverage, there are penalties. A lot of people are real nervous about the penalties. I'll tell you what they are and how they work. This first year in 2014, the penalty is the greater of $95 per adult or 1% of your income. Okay? So like I said earlier, if you make $40,000 a year, that 1% would be $400. So you would pay the $400, not the $95. Now the question is, and by the way, it does go up and up in the next several years. It goes from 1% to 2% in 2015, 2.5% in 2016. Okay, so they're ratcheting it up. They want to incentivize people to get on the coverage, because at the end of the day, if people don't have coverage and they end up with claims, very often those go towards uncovered costs that the providers eat, and then that turns into higher costs for either the government or the private insurers. And there's all these reasons why they want everyone to have coverage one way or another. If you don't have coverage, well, what's the consequence? That tax penalty, there is a 3-month grace period that says, let's say, I lost some coverage and then I sign up within 3 months. That's considered continuous, no gap, no consequence. Otherwise, it is prorated by month. So let's say instead of the full $400, you were only without coverage for 6 months, so half as much, so a $200 penalty. But how do they collect it? It's through the IRS. okay? Which it's a special kind of, like, you might call it like a level 2 cost, which means they can't seize your wages, they can't come after you and tell you you have to pay this. I've seen ridiculous emails around the internet that said, I got this letter and they said if I didn't sign up right now they were going to seize my home and all that. No. What it is if you were entitled to a refund, they would reduce your refund by that amount. That's the most actionable things from what we've seen. And that is, again, for calendar year 2014, which you'll be doing in 2015 when you file your taxes for 2014, about a year from now. So that's the consequence of not having insurance. The larger picture is, why have insurance? I have this conversation with people all the time. Let me get up on my soapbox. I'll tell you some of the things that I tell to mostly employees. Insurance is legalized gambling, okay? You're betting you're going to get hurt or sick. The insurance carrier is betting you're not. Now, in this analogy, the insurance carrier is like the casino. They're the house. They write the rules, they write the plans. Across the big picture, they're not going to lose. If they are thinking they're going to lose, they're going to lose money, they just will decide not to play. And they will either not participate in that state or they will not offer that kind of a plan anymore. So right now we're in the middle of this very awkward kind of a three-partner dance where you've got the government and the various government agencies, you've got the health insurance carriers, and then you've got the end users, companies and individuals who have this coverage. And what we're seeing is one partner makes a change, like the government changes the rules, and then the insurance carriers react, and then that changes the policies, and then consumers change their behavior. So it's sorting itself out right now. I forgot to give you my disclaimer. This is official. Everything I know is current and correct as of today. It's entirely likely that it will change over the next 12 months, but don't hold me liable, just tell you what I know. So in this further analogy of the legalized gambling, the only guaranteed money is premiums. When I'm ever doing an analysis for someone, that's the most valuable money because that's guaranteed. Every month you're going to be charged for those premiums. Because we don't know if we're going to get hurt or sick, that's all hypothetical. Now what we can do though is if you understand that there are elements of your personal situation, like I personally have something called ulcerative colitis. It's a gut disease. I have to make sure that I know how it's going to treat certain kind of conditions or treatments or whatever might come along with that. It has made me get smarter about how health insurance works, because it's for me personally. So if you have some background information, that can help guide you towards what's a wiser bet. Maybe it makes more sense for me to pay the extra money every month because I know I'm going to have predicted and expensive higher costs. So I pay for the more expensive coverage and I end up better. But otherwise, it's just dollars in and dollars out. That's the analysis that you all will end up trying to do as you look for your coverage. Okay, so talking about the plans that are out there. This marketplace, formerly known as the exchange, is just a way for people to see what they have available to them. And the first question that it asks when you either go on their website, which is, by the way, it's healthcare.gov, or you can call them. By the way, I called them this morning and talked with a gentleman named Jamal. Jamal was probably not born in, Fresno, but he did pretty well with his English. But it was obvious that he was in front of some kind of computer system where I told him the kind of question that I had. He looked it up, and it was functional. It wasn't super high level. We're not going to strategize with the person on the other end of this phone, but they can help you get enrolled. I don't think that they would have any issues with going from, I need coverage, here are my concerns, how do I do it? They can facilitate that transaction. The phone number, by the way, 800-318-2596. So I asked him a lot of tricky questions because I wasn't even sure, does everybody here necessarily have a primary residence, primary state? That's going to be one of the key considerations. But so it really is linked basically on whatever you consider your primary residence. Because people tend to move around, I would not think that you don't need to change your health insurance policy unless you're truly changing your new primary state of residence. Just because you're going to do the next 2 months in North Carolina or whatever, you don't necessarily have to change your coverage. Question?
That phone number you were using?
Yeah, it's 800-318-2596. It did take, the first person I got to was about 3 or 4 minutes of hold time, and I said, these are the kinds of questions I have. They said, I need to have you talk to this kind of a person. Then it was another 20 or 25 minutes, but I finally did get through to the person, so it worked out. Otherwise, healthcare.gov, if you do have internet access, if you're remotely internet savvy, It's pretty user-friendly. It has all these big, bold categories. I printed one of them out. How do I qualify for an exemption for the fee for not having health insurance? They're all pretty straightforward like that. And since that was a lot of people's mind, I mean, everyone's making the decision if I don't have coverage now, you know, how can I get out of the penalty? Because maybe that's really the only key driver of me doing this, in addition to maybe wanting to have coverage. And again, insurance, the definition of insurance is just protection against the unknown. What if something big happens? A lot of people think of it as a healthcare delivery system. It didn't really used to be. 50 years ago, if you needed to go see a doctor, you paid the doctor and you were done. Now we have these co-pays and all these, you know, different methods of receiving treatment, but at the end of the day, insurance is the reason why someone who is covered under a major medical plan will never have a $100,000 medical claim. That's the concept, the goal of having insurance. So let me run through the quick high points of what can get you out of this whole penalty for not having any insurance. And by the way, I didn't say it earlier, it does say it on here. If you're paying the 95 per person method, in 2014, the payment for uninsured children, your kids, is half as much, $47.50 if you have your kids that aren't covered, and that will also scale up as well. And you make the payment when you file your 2014 taxes, which are due in April 2015. So who can get an exemptions and not have to pay this? We said uninsured for less than 3 months, or if the lowest price coverage available to you would cost you more than 8% of your household income. Everything that I've seen when they talk about household, they're talking about MAGI, Modified Adjusted Gross Income. Let's see if I got that about right. No, I need to point it in the other direction. There we go. So Modified Adjusted Gross Income is the magic number we're talking about. Other ways that you can get an exemption is if you don't have to file a tax return because your income is too low. Okay? You just know you never have to file taxes because your income is too low. If you're a member of a federally recognized tribe or eligible for services through an Indian Health Services provider. And as I am reading all this, this is exactly what that guy was telling me on the phone. He was reading the exact same thing. If you're a member of a recognized healthcare sharing ministry, not exactly sure what that means. If you're a member of a recognized religious sect with religious objections to insurance, including Social Security and Medicare, might be tricky to pull off, but I have some people ask, you know, what if I'm Wiccan? And that I've just decided that this does not apply to me. So tricky, but there are some other exemptions as well. If you're incarcerated, also if you are not lawfully present in the U.S., and if you have a hardship exemption. It sounds like there's a lot of these. A lot of people might count for this. So hardship exemptions, you may be eligible for a hardship exemption if you are homeless, you were evicted in the past 6 months or facing eviction or foreclosure, you received a shut-off notice from your utility company, you recently experienced domestic violence, you recently experienced the death of a close family member, you experienced a fire, flood, natural disaster, bankruptcy in the last 6 months, medical expenses you couldn't pay in the last 24 months. There are a variety of these potential ways to get around it. It doesn't sound like they're going to be super sticklers. They also probably really don't want to have a whole bunch of pet PR if they're coming after people who are in tough times saying, you're going to have to give us this money. So anyhow, there are ways to apply for an exemption. There are lots of forms on the website, but that's how that part works. So in terms of plans, you'll hear this term, the medal levels. Think the Olympics. We're talking like bronze, silver, gold, and even platinum. Okay, and then there's one that's called catastrophic, which is literally bare bones coverage, no frills, not even much in the way of some basic things necessarily, usually high deductibles, but again, it's the reason, if you have that, it's the reason why you wouldn't have a $100,000 medical claim. There are some limitations. You have to be 30 or younger to be able to qualify for this, or have certain kinds of, hang on, I jotted it down, or low income. I'd have to double check exactly what are the standards for low income. We'll talk in just a second about some certain important numbers of where incomes land in terms of what plan you get and what it actually costs you and what else is available. Because they use this metric of the federal poverty level. We're talking about roughly $11,000 for a single person, or roughly $23,000 for a family. So The different states all got this option to say, do you want to expand and extend your Medicaid service, your state-based Medicaid? Okay, here again, it's called access. The different governors got that choice. Jan Brewer here in Arizona said yes. So what she did is, from the federal poverty level up to 138% of that number, so 38% above that $11,000 number, then you wouldn't be eligible for access, for Medicaid. They've expanded who is in that low earner pool of eligibility. Not all states did that. So there are definitely people who work for a state, it's typically a very red Republican state, who said we don't want to play ball, and there could be people who make more than the federal poverty level and less than the 138% who are not eligible for some of the cost-sharing subsidies and credits that are available within the marketplace, but they're also not eligible for Medicaid. There are people in this very real donut hole right now. It's very unlikely that they're going to have any consequences for not being able. They're not going to be penalized with tax penalties for the most part because of the nature of those costs. But it means that they don't have a place to get health insurance that's affordable to them. So, what the marketplace website is designed to do is it asks you questions about your scenario, your earnings, different parts of your background. I did this not too long ago with my mother-in-law because I helped her enroll for this. Okay, it asks you about your background, earnings, and all that, and then it will immediately redirect you toward Medicaid if your earnings say you should go on Medicaid. Otherwise, it will direct you to the marketplace. Now, within the marketplace, it will show you different levels of plans. We talked about bronze, silver, gold. Those labels help to kind of keep plans side by side pretty comparable. What they're based on is what are called actuarial values. It means across big populations, actuarial values are, for a claim, how much does the person typically have to pay out of pocket, and how much does the insurance cover for that person. So let's say for a $10,000 claim, a bronze level plan has an actuarial value of about 60%, plus or minus 2%. That means the insurance company is going to cover about 60%, or like $6,000 of that, and the person's cost out of pocket would be the remaining 40%, about $4,000. That is one scenario. That is just a big number, but it could be that based on how your plan works, they cover $8,000 or $2,000. It is really based on the law of averages and how these plans cover all different kinds of treatments. But that's how they grade these metal levels. So bronze is 60%, silver is 70%, gold is 80%, platinum is 90%. Okay. There are a lot of carriers who may not even offer a plan. Maybe the best that they offer is gold, because platinum is a pretty rich kind of a plan. Now, the question is, what's it going to cost you? And there are two key terms that sound similar, but they're a little different. One is a premium tax credit. That means the money you pay every month for your premiums to have this coverage, what does it cost you? Depending on your earnings, there is a sliding scale from that 138% of federal poverty level up to 400% of federal poverty level that says you are likely entitled to some kind of cost-saving measure for you, premium tax credit, to make your monthly charges lower. Okay, the more you earn, closer to that 400%, the less the government is going to chip in. But in my analogy of gambling, let's say you're going to roulette and you're going to bet on either red or black. You know, that's the am I going to get hurt or sick, red or black. Let's say you bet red. Well, if you're betting $1, in this case, maybe you only put out 75 cents and the government puts in the other quarter. You still get the same bet. You still win the dollar if you do get hurt or sick or whatever, but it's not all your money. So it is kind of making it cheaper and more incentivizing for you to have this coverage. So that is a premium tax credit, different than a cost-sharing subsidy. That says if you fall within the bare minimums to get coverage through the marketplace up to 250% of the federal poverty level, well then, in addition to making it cheaper for you, then they're also going to enrich the plan so that when you go to use it, because you're sick, you're going to go see a doctor or a hospital, then the plan actually costs you less out of pocket when you go at the time of using it. So what I saw with my mother-in-law was, what they do is they take the plans based on the, I don't know why, the second least expensive silver plan per state. Okay, that's the benchmark cost. Okay, and they'll look at that, and then if you're looking at silver plans, what we saw was she was looking at silver plans she picked on a plan that had a $1,500 deductible. And just like with car insurance, deductible is the money that you pay out of pocket before the insurance really kicks in, okay? Except for things like co-pays, but that's what the deductible is going to do for you. So even though she clicked on a plan that said $1,500 deductible, by the time it said, oh, and I see based on your earnings that you are underneath that $250 because she is recently widowed and not really working and stuff, that's her earning schedule, then her deductible actually really is only $700. They lowered her deductible, and her co-pays are also cheaper. So they make the plan more affordable depending on your earnings level. So that's the things that they do to make the plan cheaper for you. That's why using either a marketplace helper, sometimes you'll also hear a term which is a navigator. Navigator is like a third-party helper in addition to the folks actually at the marketplace.gov website or their phone. You can use a navigator as well. They're supposed to know exactly what's going on. They're just not supposed to give you any specific advice of, I really like Aetna or whatever. They have to be just factual. You ask me this question, I tell you this kind of an answer. But just another resource. So going through that, eventually you land on, this is the plan that makes the most sense. Before I forget, if you qualify based on your earnings for some of those cost-sharing subsidies, I didn't know because my mother-in-law was planning on like a shoulder surgery. She's like, I'm going to have a surgery. I better get really good coverage so I don't pay a whole bunch when I go and do my surgery. Well, we were looking at gold plans. They were really expensive. And then we looked at silver because then we found out, oh, once you're in that silver category, that's when they kick in all their cost-sharing stuff, saving measures and stuff. So yeah, you could pay a whole bunch of extra money and go on gold, but it's probably a worse plan for way more money. So you have to understand that it's based on the silver level. That wasn't all that intuitive for me, so I wanted to spell that out. So you land on the plan that makes sense to you, and then you get redirected to that carrier's website. In Arizona, what we're seeing is HealthNet tends to be the most competitive, dollar for what you get out of this plan. There are 6 carriers here in the state of Arizona that participate through the exchange. It's ABC, Aetna, Blue Cross, and Cigna. Then 2 H's, HealthNet and Humana. UHC, United Healthcare, they said, no thanks, we don't want to even mess with it, at least not through the marketplace. And then finally, there is a co-op called Meritus that is just kind of starting to get into these waters. Other states have co-ops that are doing relatively well. We'll see how Meritus lands. I'm going to a rollout seminar from them next Tuesday. A little behind the scene, but you know they're trying to get up and established. So those are the different carriers. You pick your plan, the carrier, then you get redirected to the carrier website where you actually finally enroll, where they take your name, your date of birth, and your address so that they know where to send your ID card, and you would determine how you're going to pay for it, whether it is via a credit card or a check. Now I did ask, and the guy that I talked to didn't have a great answer, but the question was, what if you are the, quote, 20% of Americans who are unbankable and you don't have a credit card or a checking account? Tricky. We do know that a lot of people have signed up for insurance coverage through the marketplace and have not yet made a payment. So a lot of that still has to get sorted out. Again, it's a whole new program everybody's trying to sort through. I'm thinking that is most of what I had on my list to talk to you about. One thing that I was going to just refresh was all the new written plans have to include these 10 essential health benefits. It's things like being able to walk in and see a doctor, called ambulatory care. That one's weird because you think ambulance, but no, it's like I'm ambling into a doctor on my own accord. I'm going to go see a doctor. Co-pays, for example. Hospital coverage, pharmacy coverage, coverage for pediatric, oral, and vision care. That's a new one that a lot of plans didn't have to include in the past. Mental health. This was hugely neglected by standard insurance carriers, and now through what's called mental health parity, they have to treat mental health concerns the same way they treat physical health concerns. Also, pre-existing conditions. When you sign up for one of these new Affordable Care Act qualified plans that started 2014 and later, it means that if you have a pre-existing condition, they cannot charge you more for your coverage. You know, when I said going through the website, all they're asking for is the state where you live. They will ask you your age. They'll need to know your zip code because that does matter. And it's kind of counterintuitive. You might think like, you know, if I'm living in New York City, maybe coverage is really expensive. Not necessarily, because there's lots of providers there. If you're living in rural Kentucky, maybe that's actually much more expensive than living in Louisville because there's only one network out there and it's hard to get competition. So it is based on your income and your age, and finally, whether or not you use tobacco. They can charge you more if you do use tobacco, but that's all that they can ask. They can't care about whether you have diabetes or ongoing cancer or whatever. Same cost, and they have to treat your pre-existing conditions day one, so long as it's one of these new plans. Wellness and preventive is also a recent feature that was actually rolled out several years ago, but it is built into all of these 10 essential health benefits. It's things like an annual physical. Ladies, well, woman. If you have kids, it's like screenings and immunizations. All your well baby, well child, you go in every few months and things like that. There are a lot of things that are now included. As you hit certain milestone ages, it would be things like a colonoscopy or a mammogram. Now, interestingly, I told you I have ulcerative colitis, so I've had the pleasure of doing 5 colonoscopies in my life. When I go and do that, that's not wellness and preventive. That's not routine maintenance. That's part of an ongoing diagnosed and treated condition. But if you're 53 years old and the doc says, Frank, you've never been, it's time to just, bite the bullet, go do a colonoscopy, let's make sure everything's good. Frank goes in, everything's good, no cost to him, because he's just doing his due diligence. That's wellness and preventive. Now, if he goes in and they find something, polyps, cancers, whatever, and they have to treat it, now it's going to be treated as however that health insurance plan treats those kinds of procedures. But just for the sake of you doing what you're supposed to do to keep yourself healthy, that should be zero out of pocket. Sometimes you have to guide that doctor or their nurse or their billing rep to say, hey, I am here for my wellness visit. Make sure I don't pay you a copay. Now, if while you're in there and you say, hey, you know what, by the way, while I'm here, I've been having this issue with my knee and I've got this rash on my shoulder, can you look? Well, now they might write diagnosis and treatment codes, and all of a sudden it gets coded through the insurance as an office visit. So just understand that's how it's all kind of working behind the scenes. But just doing your due diligence, wellness preventive, zero out of pocket. That has to be on all plans, all levels of coverage.
Is that unless they were a pre-existing plan that you chose to keep?
So if you're still on a plan that is prior to these Affordable Care Act standards, it's very likely that these are already in place for you unless you have a plan that's called grandfathered. A grandfathered plan existed prior to October 23rd of 2010, and you have continued that same grandfathered plan ongoing, so it's still under the old rules. But any plan that was started within the last several years would already have the wellness and preventive built into it. Okay. So one other thing that's important to note as you're shopping for your plans, preferred networks. A lot of carriers are jumping on this bandwagon of how to keep their costs down. Well, it's by hooking up with a special, refined, preferred, limited network of doctors and hospitals because they've worked out a better deal. Maybe they have some smart technology that helps them avoid duplicate and wasteful testing. Like Dr. A wants you to go get this blood work done, and Dr. B says, I want you to go get some blood work done, and some of it's the same. Well, hopefully they catch that in advance so you don't waste your copays and they don't waste their insurance money. It makes it cheaper for everyone. That's the concept. It's sometimes called an ACO or an accountable care organization. If you're looking at healthcare plans, it might mean that instead of seeing your standard PPO, preferred provider organization, you might see an EPO or a POS. What it means often is that it uses a select, refined, narrower network of providers. So you need to make sure that if there's a doctor or hospital that you want to make sure you can continue to see, are they not only in the full nationwide PPO network for Blue Cross or HealthNet or whomever, are they also part of this preferred network if that's the one that you're signing up for? So it's a challenge. Usually the carrier website is the definitive source to determine, is this person not only in the full network, but are they in this limited network if that's the plan that you end up going with? Because don't take a doctor's word for it. They'll be like, oh yeah, we take Blue Cross, but they don't know the difference of that little thing, and at the end of the day, the onus comes back on the person using the benefits. The doctor's office, you can't really hold them accountable. Sometimes they'll work with you, but I just have seen a lot of those things playing out lately. So, just to talk briefly on group health insurance, if someone out there, maybe they own a crafter booth and they've got 4 employees. Until you have 50 full-time employees, there is no requirement that employers offer any kind of health insurance. Under 50, full-time employees doesn't matter. Over 50, you don't have to worry about it until at least 2015 or 2016 if you're between that zone of 50 to 100. So it's rolling out. There are a lot of recent changes of how health insurance works, but for the most part, I thought most people here would be talking about individual coverage. So that's most of what I brought. For those of you here in the audience, you've got a handout which I can get to people electronically if they track me down and ask for it, with some really good explanation videos. There's one that's done through the Kaiser Family Foundation, which is a nonprofit that helps people digest, especially healthcare related news and events. So that's on here. Or if you just Google Kaiser Family Foundation, ACA, Healthcare Reform Video, something like that, you find it. Also, the AARP, like the Association of Retired People, they have really good info on their comprehensive page as well. A lot of really good links. If someone wants to do the homework to figure out what they are eligible for and how it's going to affect them, the information is out there. But it's all new, and it's a matter of sifting through and making sure you land on your right answers. So, any last quick questions? Jeff?
Would you say when I was signing up for the healthcare network that you're finding more deals and more reasonable rates with the silver plans?
Well, what it is you may be eligible for a cost-sharing subsidy that reduces your overall cost so that it becomes affordable. But that subsidy and the premium, that's a premium tax credit or a cost-sharing subsidy. Those are all linked to the silver plan level. Okay, so make sure that you're looking, even though you think bronze is the cheapest one out there. If you are qualified, look at silver if it doesn't automatically direct you straight to silver, because that may be where your discounts are actually kicking in. And if you go outside that silver tier to gold, bronze, whatever, you may be passing up some free government money to help make it cheaper for you. Question?
Okay. Well, as you mentioned earlier, for example, when you were saying about as far as states, I use my son's address for mailing address.
Right.
I don't live there. I live in my area, wherever it is fine.
Right.
Right.
So basically,
I'm on the
for
road.
tax purposes.
I'm on the road 11 months out of the year.
Yeah.
I come back here and spend holidays with my kids and start off again.
It's all linked to how does the government know you, and the most consistent source is taxes.
Right.
So at some point, if you're paying taxes and you have a state listed as your taxes, for simplicity's sake, that is the most direct way to, here's the state that I should list going to each state.
So I've got, because of the shows I do, what have you, I've got Arizona for 4 months.
Okay?
Okay. I'm also in Texas for 4 months.
Right. You can sign up through the marketplace for whatever state
Right.
you're
But I'm
going.
saying, okay, but that's not, I set the whole thing up for Arizona. Okay?
Yep.
Then I go to the show in Pittsburgh, and I get sick.
Right.
What's going to happen?
Important question, because your situation would be important to make sure that the plan you choose doesn't have a locally based preferred healthcare network. So you would want to make sure that you're picking someone that does have a national network, because otherwise you may be out of network, which is always way more expensive.
Right.
Unless you truly change and you have established a new physical permanent address elsewhere, I can't see where they're ever going to say that you should have to change who your carrier is, but you would want to make sure that you're using a nationwide acknowledged healthcare plan. For that reason, you may need to lean towards more of the more established names like the Blue Cross, Aetna. A lot of the larger players, they really do have national networks. However, I said Aetna, now I have to tell you that Aetna, as of 2014, the only individual plans that they offer, especially through the marketplace, are preferred limited network plans. They call them the Banner Network. So if you live in Tucson, you're out of luck, even if you are an Arizona resident. So Aetna, if you don't live in the Phoenix metro area, is probably not your best choice to actually source care. All right, question?
So along that same line, for those of us who are in many places throughout the year and could claim an address in any one state,
Right.
that could very well be valid. Because right now our mailing addresses are very often kind of random. Just if we have a family member who lives here,
Sure.
we use that address. Are there better states to?
About 2/3 of the states have defaulted to the federal marketplace. And then the question is, now that we know that, let's say, North Carolina uses the federal marketplace, then the question is, which carriers have decided to play ball in North Carolina? And who seems to be the most competitive of those different carriers? So it's definitely a challenge. It would mean some extra homework, and maybe even it might mean doing some research as a ghost, like, hypothetical person to go in and check that out. So you might run some scenarios as if you were, just change your address and put everything else the same, and then see, if I do it for one state versus another, that would be a way to check it out.
all the way through.
Right. Don't go all the way through to where you actually What makes a policy official is when you pay for it. You say, yep, I want it, I'm signing up, here's my money. That's known as a binder payment to bind your policy. Usually they do have a free trial, check it out, something for, I'm going to have to remember my schooling days, maybe 10 days or more of how long you can say, you know, I started, but this isn't working out, turn it off like it never existed. So you do have a chance to check it out during your grace period, but yeah.
Can you go back to catastrophic insurance
Yeah.
for a moment? Did you say that, because that's something I'm very interested in, did you say that it's only available for people under 30?
Correct. Under 30, or I understand if you have certain income limitations. So there is a sliding scale that somehow makes someone eligible for catastrophic coverage. When you go through the exchange and you put the marketplace and you put in all your personal data, your age, your earnings, for example, then it will kick out the results that it shows you, bronze, silver, gold, and catastrophic. If catastrophic is there, is because you are eligible for catastrophic. If you're not eligible, they won't show catastrophic as an option.
When they're asking your earnings. Now, let's say a lot of our earnings are tips.
Right. It's going to be
And you can't,
presumably
it's hard to
based
say how much you're going to take the tips.
where the rubber meets the road in terms of penalties and in terms of what you got for cost-sharing subsidies or premium tax credits. It all has to do with that IRS function. So what could feasibly happen is, let's say you tell the government, I make $21,000 a year, you get these cost-sharing subsidies and premium tax credits, and then you show that you made $71,000 last year, they could say, we want our premium tax credits back. That's very realistic. That can happen.
And it's based on the AGI?
Yeah, modified adjusted gross income as claimed on taxes. So tricky. Just so you know, because it's worth mentioning, if you work for a company that offers health insurance that's considered affordable and that meets certain basic criteria, because you are eligible through a company, you are not eligible for cost-sharing subsidies and premium tax credits through the marketplace. You can still sign up. Anyone can sign up, even if you work for Intel and they pay for yours 100%. You could sign up for a plan through the marketplace, but you would not be eligible for any government money if you're eligible for another. So a lot of small businesses are saying, you know what, we could offer a small group plan, but our employees are not that well compensated. Maybe they're the only spouse working and they have 3 kids, and they would be eligible for other government, cost-sharing subsidies or tax credits. We do them a disservice if our group of 10 offers a small group health plan. We're seeing a lot of customers and employers have to juggle those realities. All right. So any other questions, come and find me one-off. We'll keep our video relatively short.